Hello dear students, in this video we will study and understand diabetes mellitus focusing on the treatment. Starting with what diabetes is, diabetes mellitus is not a single disease, but it's a heterogeneous group of syndromes characterized by an elevation of blood glucose caused by a relative or absolute deficiency of insulin. Insulin is a polypeptide hormone secreted from the pancreatic beta cells, and this hormone plays an important role in regulating the metabolic activities of the body, particularly the homeostasis of blood glucose. The American Diabetes Association classifies diabetes into 4 types. Type 1 diabetes, which is formerly known as insulin-dependent diabetes, Type 2 diabetes, which was known as non-insulin dependent diabetes, gestational diabetes, and the diabetes due to other causes like genetic defects or medications. Let us first start with type 1 diabetes. This type it is characterized by an absolute deficiency of insulin, which is caused by massive beta cell necrosis. The loss of beta cell function is usually related to autoimmune mediated process directed against the beta cells. Also, it can be triggered by the invasion of virus or the action of chemical toxins. As a result of the destruction of these beta cells, the pancreas fails to respond to the glucose, and type 1 diabetic patients show the classic symptoms of the insulin deficiency, which are the polydipsia, polyphagia, polyuria, and weight loss. Now that you know what type 1 diabetes is, we will talk about the treatment options available to treat this type. Type 1 diabetic patients mostly require an injected insulin to control their hyperglycemia, to avoid ketoacidosis, and to maintain acceptable level of glycosylated hemoglobin, which we call HbA1c. HbA1c is the average blood glucose concentration over the previous 3 months, and this parameter is very important for the diabetic patients to check because it provides a measure of how well treatment has normalized blood glucose in diabetic patients in the last 3 months. The goal of administering insulin for type 1 diabetes is to maintain blood glucose concentration as close to normal as possible and to avoid wide swing in glucose level that may contribute to long-term complications that we will talk about later. So it is very important that patient has home blood glucose monitors so that it can facilitate frequent self-monitoring and also the treatment with insulin. As we said before, insulin is a polypeptide hormone which consists of 2 peptide chains, and it is synthesized as a precursor proinsulin that undergoes proteolytic cleavage to form insulin and C-peptide. And insulin it undergoes significant hepatic metabolism. That is why it is generally administered by subcutaneous injection. And apart from the hyperglycemic emergency, which is also can be administered as intravenous. The first insulin preparation that we will talk about is the short-acting insulin, which is the regular insulin. This insulin is usually given subcutaneously, but can be used and given as intravenously in the emergency, and it rapidly lowers blood glucose. Because of their it is short action and it is administered to mimic the prandial like the mealtime release of insulin. That is why it is generally taken 15 to 30 minutes before the meal. Another insulin preparations group are the rapid acting ones. This group includes the insulin lispro, insulin aspart, and the glulicin. They have a very rapid onset and also a short duration of action, and also like regular insulin they are administered subcutaneously. They can be administered intravenously in the emergency, but regular insulin is used mostly for that effect. Also, these drugs they are administered to mimic the prandial release of insulin like 15 minutes period to the meal or immediately following the meal. And mostly they are used with the long-acting insulin, like insulin glargine. The next group is the intermediate-acting insulin. The insulin in this group is the NPH insulin. This insulin is only given subcutaneously, never intravenously, and it is used for the basal control, and it's usually given along with rapid or short-acting insulin for the mealtime control. This insulin is useful to treat all forms of diabetes except the diabetic ketoacidosis, because that one is emergency. And we call it intermediate because of the delayed absorption of it. Is the conjugation is protamine, forming a less soluble complex. The last group of the insulins are the long-acting insulin preparations. The insulins in this group are the insulin glargine and the insulin edema. The isoelectric point of the insulin glargine is lower than that of human insulin. That's why it will lead to precipitation at the injection site, and the duration of action will be extended. That's why it has a slow onset of action than other insulins and has a flat, prolonged hypoglycemic effect without peak. And also it must be given subcutaneously, both of them, the glargine and the edema. Sometimes there are insulin combinations, like there is 70% NPH, which you remember it is the intermediate one, plus 30% of regular insulin, which was short-acting. Also, there is also 50% of NPH and also 50% of regular insulin, like that. I want to conclude this lecture with a drug called pramlintide. This is a synthetic amylin analog. Amylin is a hormone that delays the gastric emptying effect, and also it decreases postprandial glucagon secretion and that also it improves satiety. And this drug it is indicated, or it can be used as an adjunct to mealtime insulin therapy in patients with type 1 and type 2 diabetes. Thank you for watching this video. Please don't forget to subscribe to this channel.